So, Bryanna, I'd love to get an introduction of what is your role on the interdisciplinary team and how do you support our patients at the end of life?
So basically, my role on the team is to work with families as a family unit in a lot of cases, to use music as the medium to achieve a goal, a clinical goal of some kind. So often when I'm working with our hospice patients and their families or their advocates and their care teams, it looks any number of ways. And it's really hard to make a blanket statement, but some examples of a goal that we may be working to achieve are increased opportunities for relaxation, increased quality of life and meaningful connection between family members, legacy projects. Sometimes we work with individuals to write songs about their lives, to do autobiographical work, or to do any number of things that can be emotionally processing, can be emotionally expressive. So really, we come in as music therapists as a psychosocial support for the patient, for the families, and oftentimes too for any number of people in the family unit. Not always is it the unit completely together, but sometimes it's a sibling, or sometimes it's a child. Sometimes it's the parent if we're working on a case in which maybe it's a pediatric hospice case. So music actually has this beautiful neurological power, right? To hold space, to hold things that are really hard for us to process. One of those things being what exactly it's like when somebody that you care about is on hospice care and when they're approaching the end of their life. So I work on the interdisciplinary team directly with families. And I also collaborate with the members of the interdisciplinary team. So nurses and social workers and chaplains, any type of spiritual care member, child life specialists. And I really start to become supports not only for them, but for our hospice patients and the unit as a total.
That's such a wonderful summary. And I'm curious, how does the interdisciplinary team recognize when you're needed, when you're not needed?
So the kind of way I even show up, right, is so different depending on the situation. Sometimes it's an assessment by the social worker during admission. And sometimes it's very clear that this family could benefit or this patient could benefit from music therapy services. Maybe the patient expresses, oh, I have experience as a musician earlier in my life, and I still find an abundance of meaning in being in a musical situation, whether that be seeing live music, listening to music, whether that be feeling just emotionally tied to music at this point in their life. Sometimes too, caregivers can notice their loved ones being connected to music if the patient even isn't able to express that. An example of what that may look like is if somebody is very agitated and maybe they have dementia or they have a diagnosis in which it maybe feels that there could be like pharmacological intervention and this and that, but they start to notice, oh, when I put on this certain type of music, or when they're watching this certain musical, or when they're engaging in music in some way, that agitation seems to go down a little bit. A lot of times people are not 100% sure. And they're like, music, I like music's great. Sure, let's try it. And then it's my job to come in and to say, okay, so here's an example of what music therapy is. I show up with my guitar on my back and it's really a funny scene. I have my mask on and my guitar on my back and I have a bag full of instruments. And I'm like, what's up? How are you? And a lot of times people are like, what in the world are you going to ask me to do? So the initial referral comes from a social work, typically. It can also come directly from family members. It can come directly from any number of people on the interdisciplinary team. But I'd say 99% of the time it comes from social work. Once I get that referral, I then make the determination of, okay, what are we going to focus on? What really are our goals of care? Because what we're looking for is not just to sit and sing songs and have fun. That can be really beneficial in its own right. But music therapy is the clinically evidenced practice of using music to really achieve those goals. And then on my end, after I do an assessment, after I work with a patient, after I work with a family, I come back to the IDT and I say, hey, I see your assessment social work. I see your assessment nursing. I see your assessment spiritual care. This is my assessment. Now let's strengthen all of our understandings of this person, of this family unit as an entirety. So I'm not just looking at things that are very specifically minute, right? I'm not looking at oxygenation levels or blood pressures. That's a really important thing that nursing takes a peek at. It's not really my specialty, but what I can notice is, okay, we sat and we engaged in an intervention that was specifically designed for this patient, and we were singing together. And we sang Elvis Presley's Can't Help Falling in Love with You. And that person has their late partner in a photo next to their chair. And during that song, they stopped singing during a certain lyric, but they looked over at that picture during that certain lyric. And moments later, they were able to come back and be reoriented into the song. And afterward, we could have a conversation about that where they could take this space, they could reminisce, they could tell me a story about that person that was so important to them. And that's what we're looking for. We're looking for these moments where somebody can really have an opportunity to express themselves in some capacity. And that's really essential for the IDT team to know, because this is not just a number and it's not just a person. This is a person who has lived a complex life just as complex as yours or mine.
Wow. I'm blown away. And I'm now thinking about all these opportunities for music, and especially for people who feel constrained by their physical condition, their illness. They're looking at a certain narrowed horizon. But there's freedom in the space of music. You can escape, you can identify with a different story, you can make your another story, you can fall into prayer, fall into remembrance, you can fall into all these things of legacy, as you said. This is a really powerful meaning making practice as much as any other written form. And patients may feel more apt to do it this way with a known song or with a song they've had a history with. I've seen people, like musicians who are not board certified music therapists, donate their time to a hospice house, to a patient hospice facility. And is there a large, just musicians that are getting themselves involved in this work?
Yeah, I've definitely come into contact with a ton of folks who are performers who do want to volunteer their time. And I think that is such a beautiful medium. The trick, though, is then making sure this is where we get into the muddied water and the gray area between what is music performance and environmental music and volunteer services, and then what is music therapy practice. The really important distinction is that music therapists do have a specific level of training, a specific university level bachelor's degree in music therapy, which is its own designation. And if folks are looking to get music through the doors, if they're looking to have environmental music for people, if they're looking to have performers, that is absolutely an available thing. I think people really do find a ton of meaning when they're able to be in spaces sharing music together. And then creating a music therapy, a therapeutic a delivery is its own different thing. And I think both have a seat at the table. It's really important that we validate both of those things as being really important, because at the end of the day, when we zoom out and we say, what is the goal of a service delivery? It's to increase the quality of life of an individual. So even if a music performer, if a volunteer who's a performer comes in and they are in music with somebody, that's not to say it's not a therapeutic medium. That's to say it has its own therapeutic benefits. And then when a music therapist comes in, we're able to dive a little deeper with a little bit more training and be able to unpack what exactly it is that we're experiencing in the music. And then what can that person take away from the experience?